Hi, good morning, everyone. Sorry, I think we're just having some technical glitches. Bethany, I think you're muted. You can't hear us.
I'm so sorry about that. I forgot to unmute. Okay, we'll do a very quick version of the announcements. So thank you so much for joining today's webinar titled Donor Considerations for Working with Public and Private Sector Operators and Supply Chain Programs. We have a wonderful broadcast for you today, and we'll begin with just a few announcements. So we would love to hear from you, and we welcome your questions at any time. Just pop them in the chat box on the right-hand side of your screen, and we'll get to them when we pause for Q&A at the end of the broadcast. And these web conferencing platforms are getting a high volume of traffic these days, so we just ask that you bear with us in case there are any glitches with the technology. And finally, we ask that if you're not speaking, that you please mute yourself to keep the line nice and quiet while others are talking. And that's it for just the little announcements portion. And now let's take a peek at our agenda for today. First, we'll have our moderator, Dan Rhodes, share some introductory comments to frame today's discussion. And then he'll lead us through a discussion with our expert panelists around planning, financing, and sourcing supply chain activities before we move to Q&A. And as we move to the next slide, it's my pleasure to hand it over to our moderator, Dan Rhodes, our Senior Director for Procurement and Logistics at Palladium. Dan, over to you.
Great, thank you so much, Bethany. It's my pleasure to introduce our panelists today. So if our panelists could kindly turn on their videos, I'd like to be able to introduce you all. Thank you. Providing a private sector perspective today will be Mr. Imrich Aurort. He's the Director of Institutional Clients and Medical Services at Europharma. And providing the public sector perspective today, Mr. Gamal Muhammad Ali, the former Director General of the National Medical Supplies Fund in Sudan, and currently the Supply Chain Transformation Chief Strategist at Pamela Steel.
Dan, you're muted. Could you unmute your microphone?
In the first webinar, we discussed how to strengthen local procurement of medicines in Africa. Today's webinar will be focused on the alignment between donors, the public sector, and private sector. And in the final webinar in the coming weeks, we'll discuss public sector engagement at the national level within countries. So to set the scene a little bit today, we know that international donors have invested significant funds over the past decades. With that funding in place, we've seen significant improvements in the availability, the access, and the quality of life-saving commodities. We've also seen significantly reduced stockout rates. Potentially the most important thing, though, donor support has really galvanized host country commitment within the supply chain ecosystems. The key means we've seen to delivering these great results over the past 10 years. First, I think, is the focus on strengthening of the public sector operated supply chains. And second, is an approach that leaned heavily on donor implementing partners to really drive performance improvements with their public sector counterparts. We note here today that this approach is evolving, and we're seeing an increasing interest in engaging the private sector, transitioning to the greatest extent possible from government implemented supply chain operations to government stewardship, and increasing the involvement of private sector operators, which seems to be the key to long-term sustainability at the country level, especially as donors and implementing partners start to scale back work within the countries. So this brings us to our objective today. We'd like to hear the unique perspectives on how to realign public and private sector supply chain activities. And to narrow down kind of a very large topic area, we'll frame our questions around planning, financing, and sourcing functions of the supply chain. So without further ado, for our first topic, we want to start from a commonly agreed statement that donor implementing partners are really the driving force right now of upstream and downstream supply and demand planning at the national levels. That's not to say the governments aren't significantly contributing, but we do currently see, a large leveraging of the donor implementing partners. So we ask ourselves, with this in mind, what does the future hold for supply chain planning in a realigned future? So first off, I'd like to ask Marasi Mwancha if he could provide his perspective from the donor side of the house.
So thank you, Dan, and good morning, everyone, or good afternoon, depending on where you are, and thank you for joining this webinar. So I'll start with a fairly generic view on how, as Global Fund, we see private sector engagement in the supply chain, and then get specifically to the planning portion that Dan mentioned. So from our perspective, supply chains are critical in Global Fund's fight against HIV, TB, and malaria. And we see this as a key enabler for Global Fund and other its partners trying to meet the SDG 3 of good health and well-being of citizens across the world. Now, late last year, along with our partners, many of you may be included in that, we finalized the supply chain strategy for the Global Fund. And in that strategy, we articulated our vision and strategic objectives for improving the supply chain, which focus on driving improvements through country stewardship, leveraging of the private sector, among other areas. And through that process, what we also reaffirmed and identified through our 5 strategic areas is the roles that Global Fund should play as an institution, which include coordination and advocacy, serving as a change catalyst, developing capacity, fostering innovation, as well as optimizing investments in supply chain. Now, 2 of these are very focused on how we engage the private sector. And this is the role of change catalyst and fostering innovation, where we as Global Fund see that it's important that in order to transform how supply chains currently function, we do so by supporting the development of country-specific supply chain plans, standards, strategic planning efforts, to be able to support them in identification of resources for financing the supply chains. Secondly, leveraging the private sector for best practices, incubating innovations, serving as knowledge hubs to drive significant improvements in the supply chain. Now, coming specifically to Dan's question on supply planning, what we have seen over time in terms of the current state is that forecasts are increasingly being done on time, supply plans are increasingly being coordinated, and we're seeing improving quality of those forecasts and supply plans, less variability, better order consistency as well for our manufacturers. Now, at the same time, when we look at the landscape as it is, I think it would be fair to say that we perhaps haven't seen enough information system maturity. And why I focus on that, because we realize that those are sort of the bedrocks for making sure that your central medical stores, your procurement service agents, your donors, etc., are fostered or furnished with a high quality data on what you have on stock, the consumption, your issues that will help support improved and high quality supply planning and forecast, whether you're working upstream or downstream. So quality, both in terms of timeliness and completeness, I think also has some room for improvement in that regard. So stepping back to 2019, a group of donors that includes the Gates Foundation, DFID, Gavi, the USG, including PEPFAR, PMI, and Global Fund, coalesced around sort of 5 strategic areas of collaboration, which include procurement and planning innovation. And 2 of the areas of conversation, especially in planning, is what we're going to focus on today. Now, the commitments were made to try and ensure that as donors would work collaboratively to improve end-to-end supply chain visibility as a way of making sure we're able to support improved upstream planning. There was also a commitment made that we'll also leverage technology to try and understand the demand signals at the points of consumption most closest to the patient in a much more clearer and faster time period. And also using this data then to support how we improve our procurement and also planning for upstream supply chain, leveraging control towers, LMI systems, WMSs, etc., to ensure that ultimately we're getting commodities to the patients that we need. So in terms of what the future state looks like, I think as we have already committed since 2019 to now, the intent is that we'll be aligning our funding within the boundaries of our organization to make sure we are prioritizing investments that will help improve the availability of data for all the upstream planning pieces that are required. And on top of that, we're also focusing on how we make sure that we're looking at the link between those planning and the health outcomes. And so we're also increasingly focusing on measuring and implementing metrics that gives us a better sense of how we're doing our planning as well, looking specifically at forecast accuracy. So the advocacy to expand our collaboration is going to be a key part of our focus, and using that to making sure that we're building on the foundational elements to strengthen current practices for planning. That's it from my end.
Great, thank you, Marasi. If we could, just a quick administrative note, we'll work our way down through the discussion here and let our speakers present their thoughts, and at the end we'll be following up with Q&A. So please do take notes and add them into the webinar, and we'll start tackling those towards the end. So now, Imric, if you don't mind stepping up and providing your perspective on this question.
Yeah, hi. Good afternoon, because in Paris right now, where I am, it's afternoon. So good afternoon, everyone. My name is Emmerich, and I'm going to be speaking from the vantage point of a private operator, more specifically that of a large drugs wholesaler distributor with a focus on Africa. I say large because we cover about 30 markets. And we operate under a dual distribution model. The first part of the model is our core model, which I could call the Laborex model, because that's the brand name of our subsidiaries. And under that model, we do a lot of deliveries of small, mid-sized quantities to pharmacies, hospital, clinics, etc. So under this model, we have a physical subsidiary in country with its own warehousing and transportation capabilities. So let's say that's the small scale model. And then we've got the bigger scale model that we could call Mission Pharma model. Again, it's the brand name of the subsidiary. And that's more for very large deliveries, contract or campaign based. Very large deliveries of quantities of drugs to UN agencies or local ministries of health, directly from our consolidation platform in India to the destination. And both models, the small scale and the larger scale model, probably apply to donors. The small call-off model, the small scale model, serves to ensure a steady supply of certain essential drugs to health centers, public clinics, etc. And the mass delivery model is better suited to large health campaigns. Now, from a planning point of view, each model has constraints, but maybe more so the first model, the smaller scale model. Because the quantity of drugs that we can warehouse is limited for two main reasons. First of all, we don't have infinite warehousing space, and there's a cost to that space. Just to give you an idea, we're going to build a new warehouse in Ivory Coast, and the project is probably going to cost around $15 million. And from a very cynical private sector perspective, we have to make that money back somehow. So that's the first reason. The second is that drugs expire. So if we hold a large quantity of drugs in our warehouse and they don't get called off in time, well, there's a big risk there. There are multiple solutions to these constraints to the first model, but none of these solutions is really ideal. The best solution would obviously be to have a very accurate forecast of the demand patterns for certain key drugs. Well, we're able to do that with the clients such as retail pharmacies, because their consumption patterns are unlikely to change dramatically. But for donor programs, this data is likely to be deficient. So when this solution is not really possible, there are other solutions. One is very costly, is for donors to be prepared to pay a premium for express delivery of drugs from our consolidation platforms, let's say by air as opposed to sea. Again, the cost is very significant. Another solution would be for the donors to be prepared to retain ownership of the drugs that we have in their warehouse so we don't have to worry about expiry or replacement of the drugs. But donors would also need to be prepared to pay a premium for these drugs to be warehoused, simply to make it sustainable from a financial point of view to us. So that's the constraints that we face for the first distribution model that I call the small scale or LabRex model. The second distribution model, the mission pharma model, where we deliver mass quantities of drugs related to one single contract or one single campaign, is easier from a planning point of view, because there's going to be only one or a limited number of deliveries, not a lot of small call-offs, and everything basically gets handled at one go, and the drugs get handed over to donors or local ministries of health without staying in our warehouses. So in a nutshell, that's from a private sector perspective, the constraints that we face in terms of supply planning.
Thank you so much, Imric. Gamal, if you could join us.
Good afternoon, everybody, and thank you so much for organizers and esteemed audience. I'll speak from the perspective of public sector and the situation in Sudan, which the main players in the supply chain are public sector, represented by National Medical Supplies Fund, which is like other African countries, similar to central medical stores. It is a semi-autonomous public organizations are responsible for the procurement, warehousing, and all other services of supply chain to public health facilities. And under certain circumstances, NMSF supplies private hospitals and retail pharmacies. The others, the private sector, and the private sector is growing very fast in Sudan. We have like more than 100 active pharmaceutical importers, which are local agents for overseas manufacturers. There's also the local pharmaceutical manufacturer, like more than 20 local pharmaceutical manufacturers producing like 1,000 different brands or generic brands, mainly analgesics and antibiotics. And the main dosage forms are tablets and capsules and syrups. And the third player in the pharmaceutical supply chain in Sudan is NGOs, a non-governmental organization, including donors like Global Fund to Fight AIDS, TB, and Malaria, and Gavi for vaccine and immunization, in addition to UNFPA for reproductive health. And there's also a number of international and national organizations distributed medicines in the camps of internally displaced people. This is the main sources of supply chain in Sudan currently. But to me, the ideal future situation, especially for the for the public sector, is from my own perspective, there could be like 3 different options to increase the efficiency and cost effectiveness of the public supply organizations, which is historically found in sub-Saharan Africa. The first option, from my perspective, is to fully privatize these public sector organizations to make them very efficient and more cost effective, but to maintain their objective to keep the access to medicine. If this option need to be, the government need to have a golden share in this private company, and the second option is to transform them to state-owned private companies governed by companies law instead of public laws. And then there's some experience on the state companies. And the third option is to modify the current legal status of these central medical stores to make them, by changing regulations that govern human resources and procurement and this kind of thing, to give them a flexibility. But But I think the options or to fill the gaps between the current supply chain, we see most countries rely very much on the public sector and the private sector, or to make them very efficient. I think the donors may need to change their policies, their regulations, which is currently inclined to support the public sector. And I can give an example. There is one of the donors bought like more than 150 long vehicles for one of the CMS, Central Medical Stores, to do distribution. And I think the government is the least government organizations are not expert in managing this logistics and transportation. Other option also to close this gap between central medical stores, historical and all the modality of central medical stores, and to strengthen the private sector. The other option also, donors like Global Fund could pre-qualify interested wholesalers in countries where they apply these additional safeguard policies, instead of giving this role to UN agencies or something like that to be like a principal agency in the countries. They could pre-qualify some wholesalers to do that job on their behalf. Also, the government and donors could strengthen the private sector, especially those companies committed themselves to respond to strategies and policies of the government by so many incentives, like donors could meet their needs from the national pharmaceutical markets, and they can promote this facilitation of merging of small companies in big ones, whether manufacturers or importers and wholesalers. Donors could also promote outsourcing concept, because there's still tension between this public and private sector. And donors also, from my perspective, could link their donation to government that are committed to do some structure adjustment programs to support the private sector. And lastly and not the least, I think there is a big challenge in the public sector mindset that donors and even they need to work on that, to change this mindset, to accept the private sector to play a very important role in supply chain. The media also is a very big challenge, because at least in Sudan, the media is very strongly supporting the public sector supply chain, and they thought that this private is for profit and the medicine would be very expensive. There is a challenge of rarely using medicines and those of low commercial value, and all these kind of things need to be addressed, and at least to change the mindset and to encourage the government to start thinking of the private sector to play a very important role in the supply chain. Over to you, Dan. Thank you.
Great. Thank you so much, Kamal. If we could move to the next slide, we'll look at our second discussion point. The context here is that donors have been financing a significant percentage of the life-saving commodities over the years. Again, we've seen the governments really step up and start to put in more and more share. But the reality is, donors are really another driving force of financing. So we want to look at here what opportunities exist to really transform financing within the country space, and is there a way to facilitate that change? So Marasi, over to you.
Thanks again, Nana. So Global Fund is working really closely with its partners, with countries, to make sure that we have sustainable domestic funding for health, and specifically for the three diseases: HIV, TB, malaria, commodities, as well as broader supply chain strengthening efforts. Now, where we feel we're most effective as a Global Fund is as a catalytic force, and I'll talk about sort of three areas regarding that. Firstly, we want to make sure we're advocating for sufficient domestic finance and making sure that that is directed towards your greater supply chain needs, including your commodities as well as your supply chain strengthening needs. Secondly, we believe that working with our partners is extremely valuable to make sure that we're fostering and supporting the development of sustainable financing for supply chain and your broader health priorities. And then third, leveraging the funding that we will be bringing to countries together with the domestic funding that is available in specific countries using that to enforce mechanisms that are in place to improve the supply chain. So if we look at currently where we are, we're currently trying to make sure we're focusing on developing really smart investing approaches. And we're doing so by making sure we're advising countries on what are the most optimal investments to make in supply chain, including on the commodity needs that they would have through the various forecasting quantification efforts that we would be doing together with our partners. Talking about the critical supply chain enablers that need to be in place for the commodities to move, so that we're not just focused on the commodity availability, but also what it takes to deliver them. And then making sure we are developing sort of joint investment frameworks, right? And I'll talk about sort of 4 to 5 areas around that. And the first thing we've talked about with our fellow donors is how are we going to proactively coordinate investments and making sure that we have a common investment agenda. So if it comes to a specific country, picking Sudan, where Gamal is from, how do we make sure that we're coordinating procurements for antimalarials, ARVs, or TB medicines? And then how do we engage in that investment approach throughout for Global Fund the grant life cycle, if we think about for our USD partners through their copper mop cycles, to make sure that those commodities are always available. And then using data to help inform where the greatest needs are, what commodities need to improve. And that goes back to my earlier statement that on the need for making sure we have robust information systems that feed our needs for data to inform supply planning and other upstream functions. And one of the reasons why we're doing that is that we want to even critically over the next 5 years make sure we're measuring the % increase in health domestic financing as a way of looking at how supply chains are improving. So 4 ideas in terms of how we can improve the opportunities that exist right now. So Gamal talked about policy, right? So we need to make sure we're understanding the relevant policy that exists in countries to make sure that they're supportive of engagement of both the public and private sector, but making sure that all the national laws and regulations are also advocated and updated accordingly. Next, there's a lot of advocacy and governance that also needs to take place from our end, and making sure that the policies that are put in place are to enhance buy-in of how we can leverage private sector and other players, wholesalers, for example, in terms of improving the sourcing and availability of commodities. Then we also need to make a distinct investment in the organizations and the people that need to be in place to make sure that those organizational structures are able to then manage these financing, so that as we're thinking about a gradual shift from donors to private sector players or other entities, that capacity exists to be able to absorb those funds and make sure they're being used in a judicious manner. And then last but not least, I'll revert back to the issue of technology and making sure we're identifying and utilizing systems to make sure we're enhancing the visibility of the supply chain that will support a lot of these upstream functions we're referring to.
Great, thank you so much. Imric.
Yes, so in terms, again, from a private sector standpoint, in terms of financing, the first challenge that we face, and that's true, whatever the distribution model we use, be it small scale, large scale, the first challenge that we face is simply in terms of payment default risk. I'll give you an example that I can give you because it's out in the press. In Zambia, we had been supplying essential drugs for years to the local Ministry of Health. And we let this debt balloon up to over $10 million. And we still haven't been paid for orders that date back years. So it's very obvious to anyone that's simply not sustainable. So the result of that is that we need to really limit our exposure to this payment default risk from local ministries of health. And the solution that we would like to see put in place there is for donors to guarantee payments from local governments through, for instance, a letter of credit or prepayments of orders or putting in place earmarked accounts that can only be used for those orders and deliveries. So that's one major risk that we face, and it really limits the amount of business we can do on an unsecured basis with the local governments. Then there's a financial consideration that's specific to the small scale distribution model I was talking about, with a lot of small call-offs of drugs that are being held in a warehouse. There, the financial constraint is more in terms of working capital. We simply cannot afford to have a large quantity of drug sitting unused, undelivered for a long time, because it means we have a lot of capital that's immobilized in this inventory. So there, the solution would be, again, either to have a very accurate forecast of demand that would limit the need for a large quantity of drugs to be held in the warehouse, or for the drugs to be legally owned by a donor or by a local government. And for the service that we're offering in terms of warehousing these drugs to be compensated on a basis that makes it attractive to us. And I'm sounding very cynical, but it's not just a matter of turning profit. It's just a matter of being sustainable and being able to fund our operations over the long term. So financing is really a major consideration for us. Thank you.
Thanks so much, Heinrich. Gamal, if we could return to the public sector perspective, please.
Thank you, Dan, again. And current state of medicine financing in Sudan is there are three main mechanisms for financing medicine in Sudan, and like many other countries, as I noticed. The first mechanism of financing is, and the dominating one, is out-of-pocket payment for the medicines and other health services. In Sudan, the first revolving drug fund started in 1986. When Save the Children in the UK signed an agreement with the government at that time to start this pilot in Khartoum state to start selling medicines to at 60 health centers, public health centers, and that experience in 1991 expanded to the overall country, to be all people in Sudan now receiving their medicines and other health commodities by paying for them out of pocket. This is the main mechanism. And later on, the second mechanism of financing is the government financed pharmaceuticals. And there's a number of projects started. The first one started in 1996 when the government decided to offer the patients admission during the first 24 hours in hospitals, free medications, and selected a specific list. And then over the time, this list of free medications increased to include oncology medicines and renal dialysis and immunosuppressive for renal transplantation, and also medicines for under 5. A number of programs funded by the government in Sudan, and all these medicines are supplied by the National Medical Supplies Fund, and money comes from the Ministry of Finance on monthly basis to fund these free medicines. Others are donors, mainly a global fund and Gavi and other UN agencies like UNFPA. This is very important, and this is my point of focus, is the health insurance, which started in 1996, but the coverage is still low. From my own perspective, I think the prepayment is the best solution for financing pharmaceuticals and other health products. And But the challenge here in this policy, because in developing in low-income countries, especially in sub-Saharan Africa, this culture of health insurance is not prevalent. So there's a big role could be played by donors, mainly to promote health insurance, or let us say health insurance or prepaid mechanisms, whether through tax or through health insurance. And also donors could provide technical and financial assistance to government to support them in developing adequate and responsive legal framework to strengthen self-sustainable supply chain through health insurance. And very important to me is development of financial pooling. And finance strategy for health in Sudan proposed that all donors, including the Global Fund Emirati and others like GAF, and to put all this budget allocated to finance pharmaceutical and health products, whether these budgets come from donors or from government, should be put in one basket, or in the basket of the health insurance, and then all measures should be put in place to make 100% sure that products that to be received free of charge could be received free of charge. Products that patients need to co-pay for them, and all these measures to put in place to increase the finance and to strengthen the supply chain and to make it sustainable instead of fragmented mechanisms of financing. And I think donors could support the government to institutionalize capacity building of the health insurance and health supply chains to be very effective, very stringent. Thank you. Over to you, Dan.
Thank you so much. If we can now, just looking at the clock, I think we're right on time to move into our third discussion point. Our context here is that donors and donor-funded implementing partners in the governments currently manage a range of different contracts for private sector servicing, and that's kind of across the board. That's sourcing for commodities, that's sourcing for services at the national, subnational, and even local levels at the last mile. And so we'd like to think through now, what are the highest impact options to really expand utilization of the private sector as we're downstream in countries? So Marasi?
Thanks again, Dan, and to the fellow panelists as well for the excellent points raised in the last question. So maybe to begin with, let me talk about sort of three key points from our perspective as to why we see private sector engagement as being critical. I think first and foremost, it's an important way of making sure that entities within the public sector are able to focus on their core competencies. And when managed optimally, outsourcing will also help provide value and enhance activity by helping organizations focus on what they do best. Second thing is that we believe from a private sector engagement perspective, it will also enhance capability, the capacities, resources, the tools, the knowledge that public sector entities can employ to improve overall supply chain efficiency and effectiveness. And then last but not least, it also helps to reduce costs. I mean, Amerik was talking in the last segment regarding minimizing risk. And so it's important that we can leverage them not just from a risk perspective, but also to reduce costs in terms of the infrastructure required, warehousing, and having an overall more efficient network in your supply chain. So in terms of the opportunities for expanding utilization, I'll talk very briefly about three options, and then I'll go up to the sourcing next. First, I think, is making sure we're able to foster strategic collaboration between the public and private, right? It needs to be a win-win for all entities. So not just the private sector making the profit, but also the public sector making sure they're able to meet their health and broader programmatic priorities. Now, once that is in place, I think another key thing is making sure we have the right capacities, capabilities within the public sector to also performance monitor the contracts and making sure that the vendors are actually delivering on what they had promised to do. From our part, we're also looking at how do we expand the framework guidance that we have, the policies, as Kamal was talking about earlier, to make sure we're able to advocate for this increased approach to help promote the overall sustainability and efficiency of the supply chain. Coming to the sourcing side, so on average, every year, Global Fund procures about $2.4 billion worth of commodities. And we have been doing so quite a bit over the past few years and using that to help shape markets. And those markets are typically shaped with private sector manufacturers scattered all over the world. And the approach that we take, or the objectives that we have as it relates to health products, is that we want to make sure we have availability and affordability of medicines, that those medicines are achieving quality standards. We're helping stimulate innovation, adoption of new cost-effective products, and also helping countries transition from one regimen to another or from one manufacturer to another, depending on sort of the market viability. Now, we've been actively engaged in developing long-term framework contracts. We worked with over 150 private sector organizations across 85 countries and done a throughput of over $4 billion worth of procurement. So as you can see, there's a significant emphasis from our part, even in the last few years, on how we leverage the private sector for our sourcing activities. So within Global Fund, we leverage a platform called Wombo that has been developed, and we've been doing so since 2016, to help facilitate access to quality assured health products. And this is also available to many pool procurement mechanism PPM countries and low middle income countries, and leveraging them to access products from manufacturers using the framework contracts that I referred to earlier. And primarily our driving impetus there and opportunities again for increased utilization of the private sector is how do we ensure that we're guaranteeing value? How do we ensure that price is being guaranteed? We're making sure we're the lowest and most sustainable price, making sure that we're also holding our suppliers to account for their performance, and then a commitment to making sure ultimately we have commodities at the service delivery point when they're needed to drive our program priorities. So those are the opportunities that we see both from a services perspective as well as from a sourcing perspective.
Great, thank you. Imric, over to you, please.
Yeah, so from a sourcing perspective for us, it's pretty straightforward in the sense that there's no real issue there, not because we're especially smart, but because we've been doing it for a very long time. We work with about 500 different manufacturers and labs across the world. We're able to source pretty much everything from brand name drugs to generic drugs. And we have logistical platforms in both France and India that can handle the procurement and the transportation of these drugs. We're able to cover specialty needs like temperature controlled transportation in reefers. Just to give you an idea, in French-speaking Africa, where drugs wholesalers are required by law to offer the full range of drugs registered in the country, we sell around 7,000 to 8,000 different drug types, different molecules. So definitely for us, the logistical aspect is not a real headache. It's more, again, down to, let's say, financial sustainability considerations. But let's say that logistics is something that we're fairly confident with. Thank you.
Yeah, muted, Dan.
Oh, sorry about that. I don't think it came through. If it's coming through now, I just wanted to quickly open the floor back up to you.
Thank you again. And like many other countries, especially in sub-Saharan Africa, in Sudan, there's like mainly 3 sources of medicines. Medicines that are imported from overseas, either through the public sector represented by the National Medical Supplies Fund, And the National Medical Supplies Fund in its recent, like 5 years reform, restricted this importation of medicines to local agents, licensed local agents, and only registered medicine in the country. So this is also supporting the private sector, local private sector companies by just buying from them. And also we have the private importers to sell medicine to retail community pharmacies. And we have donors. Donors imported their own medicine, such as Global Fund to treat or fight AIDS, tuberculosis, and malaria through its principal recipient, and also in addition to UNICEF and UNFPA, and there is also international national NGOs imported their medicines to be used in the emergency situations. There's also the locally manufactured medicines and other sources like illegal sources. But to me, the future, for the ideal future for sourcing the medicines in developing countries, where the private pharmaceutical sector is well developed, in my perspective, donors, UN agencies, and other NGOs may need to consider the compliance with national medicine regulations. These national regulations, require all organizations to deal with medicines and medical products that have marketing authorization in the countries. The compliance with national regulation will strengthen the private itself, will strengthen the private sector, and will protect the recipient country from receiving non-registered medicines and from weakening the regulatory framework in that country. But this is not the case in certain territories where the private sector is not well established. And in this case, I think the Global Supply Agency or like Europharma or these big wholesalers could play a very important role. But the challenge again will be how to comply with the national regulations, and also there would be this in the long run they will, weakening the national private sector. It will not grow if there's other big companies just import this kind of medicines, and there's other disadvantage for this global supply agency need to be addressed. But I think the options to fill the gap, mainly the compliance of donors with national regulations could be achieved through procurement from the national pharmaceutical sector. The main players of the national market actually either importers and local manufacturers, and donors could be and UN agencies if they started buying from them after they fulfill their requirement, like high quality medicines, following the current standard of the good manufacturing practice, and after all these measures put in place, then at that time I think the donors and others could move to fulfill their needs from the national market. The role that could be played, I think it could include the following, but it is not limited to support. The donors could support the government to strengthen national medicine regulatory authorities. This is very important to protect the population from the marketing of the low quality medicines, and there's a real big concern on this area and nowadays, as we all know. Also, the donors could support, as I said earlier, national manufacturer to follow the good manufacturing practices, and even to be later pre-qualified by World Health Organization. I think also the donors like Global Fund could, as I said earlier, could pre-qualify interested private companies to be their principal recipients in certain countries. Donors also could meet their pharmaceutical needs from national markets. And the big challenge, I think, for the private sector especially in sub-Saharan Africa, for the challenge for private sector and even for the public sector organization is timely access to foreign currency. And I think donors and even UN agencies need to think about it. And in short, I'll give you a very example in Sudan. When I was in the National Medical Supplies Fund, we started negotiation with the UNDP, and finally we ended that the UNDP could use some revenues from the National Medical Supplies Fund. We gave them on monthly basis to the UNDP. UNDP use this local currency to meet their needs in Sudan, and then procure medicines, very special life-saving medicines, because the budget allocated for the UNDP to operation in Sudan is very like 20 million per year. So they use this money, and the government signed this agreement with the UNDP to use this foreign currency to import medicines to national medicine supplies fund. So this is one of the options could be to solve the problem of the scarcity or foreign currency, and to do it at a official rate. I think also if there is a move, especially in countries where the pharmaceutical private sector is not well established, and there is a need to import from outside or from wholesalers or global supply agency, I think there is a need to expand the WHO pre-qualified scheme, instead of only for the medicine for malaria and other infectious diseases, could be expanded to other non-infectious diseases. It's very serious, and patients need high quality medicines. Thank you so much, and over to you, Dan.
Great, thank you so much. I think we can move to the next slide. And with the remaining time we have, we'll try to pose one question, a follow-up question based on the conversation. So Marasi, Gamal brought up an idea here, and he talked about financial sustainability, and that an idea might be that donors could consider consolidating or pooling some of the financial resources at a higher level to provide a stronger base of for activities such as payment guarantees. So I guess the question is there a place in the future where you see pooling of funds or leveraging funding generally to help safeguard some of the private sector investments, whether that's payment guarantees or whether that's hedging risks associated with demand volatility, to really help them get their foot in the door?
So excellent question. I would say yes, but I think we also need to make sure that that is sort of tempered within the policies that exist in country. Oftentimes, and we all understand the global fund model, our financing is typically through government, and is driven by government in terms of what their priorities are. So if a government sees a need for engaging a private sector player, either for services or for sourcing activities, certainly we'll be happy to support that, and a lot of our strategies articulate that. Now, in the case of sourcing, if you want to try and reduce the volatility that is faced on the end of the private sector players, like Marik was referring to, we'll be happy to make sure we have policies in place to provide those guarantees. But a lot of that needs to make sure it is consistent with sort of national laws and policy as well, for that matter. So short answer to your question, yes, by making sure that all of that is done through the right policies in place, making sure that in country you have the right capacity and governance structures to be able to manage some of those frameworks or contracts that would allow for that, and also making sure organizationally the capacity is built to manage such approaches. Over.
Thank you so much, Marasi. Now over to Aymeric. Marasi, during his discussion, he noted that global funds interested in increasing investment in technology to really improve visibility within the supply chains. And so I guess the question here is, if given access, and if you had more visibility, would that help alleviate some of the demand constraints that you face, despite the volatility? And if not, if increased visibility isn't the total answer, is there any other way you could imagine kind of injecting yourselves in that conversation around demand planning, to open the doors for companies like yourself in the future?
Yeah, it's a really good question. Obviously, forecasts are a game changer. I mean, reliable forecasts, because when you know how much is going to be bought from you, you know how much to buy, when to buy it, etc. So it's definitely very important. And this is not really something that we, as a private company, can do. Just because our focus is not on market analysis or market survey, and we don't even have the resources in terms of skill set or tools to really do that. So if we can rely on someone else, donors, local ministries of health, or private operators to do that, it would really change the picture. I know, for instance, that in Nigeria, for sickle cell disease testing, there's a very good American company that's been working with the local governments on setting up campaigns. So that changes things a lot. But again, apart from the tools, and we really need those tools and this advanced technology, there are also some very basic measures that are really straightforward that would be needed. To give you an example, the time it takes in a lot of West African countries these days to get a new drug registered is from 1 to 2 years. So the public's access to these drugs is really limited by red tape and processes that don't really make sense. I don't know how donors can help with that, but it's definitely an area that needs a lot of work as well, apart from the tools and the technology. Thank you.
Thank you so much, Imric. I think with the time coming down to just a couple minutes left, I think we'll pause our Q&A there and let me hand over to Bethany for some final comments.
Great. I just want to give a huge, huge thank you to our fantastic panelists, our wonderful moderator. Thank you all so much for preparing this really, really wonderful and rich discussion for all of us. I know I've learned a lot today. And that's it for today's broadcast. And we hope to see you back here on February 11th for the next and final webinar in this Global Health Supply Chain series. The webinar will focus on the role of donors in engaging private wholesalers. So thanks again to everyone, and hope to see you again soon on February 11th. And take care and have a great rest of your day. Thank you.
Thank you so much. Thank you. Yes,